Happy Friday, Baylor College of Medicine and friends of Baylor. Christmas is coming up, very excited. But hey, some good news. I thought we'd start off with some good news. It looks like the flu season is finally beginning to decline. So if you look at the numbers here, this is the CDC reported positive tests. You can see all of these are the correct match for the vaccine. They're H1N1 and H3N2, but it looks like the numbers are beginning to go down. This is outpatient visits, and finally it's beginning to come down. We had that early spike. And then it's really interesting. Mostly it's been in young kids. I mean, if you look at who is most often pretty sick by this, adults, but kids under the age of 5 in particular, you can see those numbers were going up. And this is the weekly rate of laboratory-confirmed influenza hospitalization. So even hospitalizations are going down. Case number and hospitalizations going down. And I just point this out, it's fascinating. The 2 years of COVID in 2020 and 2021, almost nothing. So this is really our first severe flu season since COVID. Similarly, respiratory syncytial virus infections are finally beginning to wane. So you can see this both in the percent positives as well as the case numbers. So finally, that's going down, and even in our state of Texas, you can see case numbers for RSV are going down. So that's the good news. The bad news is it looks like COVID numbers are beginning to go up. Just in time, those are going up, COVID will come back. There's also been two really important developments in the RSV field around vaccinations, because as we've talked about in the past, there have not been effective vaccines for RSV. And RSV, the respiratory syncytial virus, is particularly bad in young kids when they're under the age of 6 months, because they're not good at coughing up stuff, and the virus causes really severe changes in the cells that line the lungs. Some really good news about vaccine development for RSV. As you know, we haven't had an RSV vaccine ever. And finally, GSK and Pfizer both have come up with what looks like effective vaccines. For adults, it shows 85.7% efficacy in the Pfizer vaccine and 94% efficacy in the GSK vaccine. Those are given to adults, and as you remember, RSV affects very young kids and the elderly. The good news on the Pfizer vaccine is they vaccinate pregnant mothers, and that because of the passive transfer of antibodies to the infant, that protects the infant in the first 6 months. And their vaccine, the Pfizer vaccine, shows 81.8% efficacy in the first 6 months of life. So that's really great news. We haven't had an RSV vaccine forever, so this is really exciting. Now, unfortunately, as I mentioned, COVID is on the rise. If you look what's going on in the world, the real big peaks are in Japan. Remember, the prime minister had to resign because of his handling over the Japanese pandemic. But it's actually much worse with the current administration, so who knows. But Hong Kong also have a big peak. And we talked about China changing their zero COVID policy. It's very likely that China's going to have a big surge. They're not reporting it very well. I don't expect they will report it very well, but China will be a big source of COVID infections, I think, over the next several months. The U.S. is getting a little bit worse. You can see this was last month, November 18th. This is December 18th. You can see it's sort of darkening in the Midwest and the Northeast. I put on January just so we can feel good about ourselves. Remember January? Oh my God, it was so bad. The entire country was on fire. That was with the Omicron surge. So yeah, it's getting worse now, but it's not anywhere near as bad as it was in January. In Texas and Harris County, we're still very low. Our friends in Dimmitt County, unfortunately, are back up to moderate to high. But the population is so small, it takes us a few cases to be classified that way. That's little javelinas. You got to watch those javelinas. Now, in the Texas Medical Center, the numbers were going up. The case percentage rate had gone up to 6.5% last week at 6.8%, so it's slowing. That's good news. Hospitalizations have been increasing. You can see this here, but it looks like it's beginning to plateau. Nationally, we've talked about wastewater being a good indicator. The wastewater is really going up all over the place in the country. That's really kind of suggesting we will see a winter surge. There's no question about it. If you look at what's going on in Houston, also, you can see the increase in wastewater numbers. And it's pretty well distributed. These are all the different locations, and you can see every one of them is increased significantly, and we're up almost fourfold the amount of virus in the wastewater that we had about a year ago. This is being driven by the Omicron variants. What's fascinating to me, and this is staying consistent each week, it's a grouping of many variants. So not a single one of them is sort of dominating like it did with Alpha and Delta and Omicron. Now these are all variants of Omicron, and it's a big hodgepodge of them, and hopefully we think the polyvalent or the bivalent vaccine will be successful in treating those, or at least in preventing some of those infections, certainly in preventing serious infection. A few updates on COVID vaccines. Now the FDA has approved children as young as 6 months getting vaccinated, so and getting boosted. That's good. We talked a little bit about this last week. Pregnant women have been reluctant to get vaccinated, even though there's no evidence to suggest that there's a problem. In fact, there have been many studies show that it's not a problem to get vaccinated. Unfortunately, there's been a lot more sort of an increase in COVID-related complications with pregnancy. So it begins to, you start thinking about why do we have these vaccines that work and people are still so reluctant? And it's really become more like a public health issue. If you look at it, this is the vaccine distribution in the country, and we're Southeast is very, very low. And still only 14% of the United States population has gotten their booster. So what is driving that? And so there's been a bunch of survey studies beginning to look at opinions in the United States. So the Kaiser Family Foundation is known for doing survey data, and they just published some more survey data. And the problem with sort of the COVID mythology around vaccination is beginning to impact some of the other vaccines that are very effective. So, for example, this is the survey data. Should children be required to be vaccinated, even if they're healthy, to go to school? And that has gone from 82% believing that all children should be vaccinated to go to school to 71%. So it's beginning to drop. And 28% of the parents feel like they should be able to decide for themselves, and that's up from 16%. So there's sort of losing their interest in having kids being vaccinated when they go to school, which is a real problem. Remember, public health vaccinations have been very effective for measles, mumps, and rubella, and now all of a sudden people are going like, I think the parents should decide. I believe in parents deciding a lot of things, but public health is another thing. So it's some more of the survey data. Only 70% of parents agree that their children should be required to get vaccinated against MMR. That's from the Pew study. Only 38% they will get a bivalent booster. That's up from 32%, but still only 38% even acknowledge it. And we only have 14% of the country vaccinated and boosted. And then 42% of adults say they will likely get their child age 12 to 17 a booster, and 30% say they'll likely get their child age 5 to 11 a booster. So not a lot of enthusiasm for getting their children boosted. There was a New York Times survey that was very similar. 35% of parents oppose requirements that children receive routine immunization in order to attend school. So, I would view one of the big unfortunate consequences of the entire COVID pandemic and the response to COVID vaccines is that parents are beginning to lose their support for public health related vaccination. And so I just want to remind everybody, public health is important. I mean, your physician takes care of you when you're sick, but public health is there to try and keep the community healthy and prevent people from getting sick. And there's plenty of examples of how public health has been positive. It's one of the reasons our longevity has increased. So just for example, if you look at vaccination for the kids, MMR, that cohort, each year there's a cohort of individuals, kids that are born that get vaccinated. It's estimated that it prevents 42,000 deaths in every cohort that's born. I mean, that's a huge impact. It would be a disaster if we sort of stop vaccinating kids. If you look at the impact on tuberculosis, for example, where we can mandate that people be isolated because of TB. That's not a parental decision. That's public health officials can do that. We've reduced the amount of tuberculosis in the country by 30%. Think about tobacco prevention. That's a mandate. It's federally mandated. You can't smoke in schools and closed places. That has had a tremendous impact on the reduction in lung cancer, and prostate cancer, and cardiovascular disease. One of the things you may not know about, but cereals are supplemented with folic acid. That has reduced a complication of neural tube defects, which was very common as a result of folic acid deficiency in births. And the number of births with neural tube defects has decreased significantly by 36% just from folic acid supplementation. Think of motor vehicle safety. Safety belts reduce the number of motor deaths. 13,000 lives are saved each year because of the use of safety belts. I mentioned cardiovascular disease reduced because of the reduction in smoking. For those of you who are big fans of The Deadliest Catch, I like to watch that on TV, there have been occupational health mandates put in place for protection of workers in farm injuries, but also on the Bering Sea, reduction of 770 deaths per 100,000 to 260. So, and one of the most dramatic ones is lead poisoning. If you think about childhood lead poisoning, the percentage of children between age 1 and 5 that had lead levels greater than 10 micrograms per deciliter fell from 88% in the United States to 0.9%. That's a federal mandate. It's not a parental decision. That has saved a huge amount of problems with lead intoxication in children. So as we are in this national debate around parental choice, think about there are things that are really important for public health, and we need to think about those as we balance what should be a parental right with what's the right of the community and for the better health of our country. So I want to finish this week, first of all, by wishing everybody a great holiday season. This year is one of those unusual years where Hanukkah, Christmas, and Kwanzaa overlap, and so I want everyone to have a wonderful holiday weekend. I also wanted to give a giant shout out to my friends in Dimmitt County. Here in the Cariza Springs Javelin, one of my favorite newspaper to read. They have an article on the fact that the VA has placed a mobile medical unit in Dimmitt County to provide services to our rural veterans. So congratulations, Dimmitt County, and congratulations to the VA. So have a great weekend. Have a wonderful holiday season. I can't wait to see you next week.
President's office.
It's Santa calling for Lily.
Please hold.
Lily, Santa is on line 1.
Hey Lily, we're having some supply chain problems here at the North Pole. Can you give us a hand on the East Coast run? Ho, ho, ho! Excellent! Oh yeah, one more thing. I can't send Team Rudolph and Blitzen. I have to send you their cousins, Randolph and Oscar.